Hi, my name is Olga. I'm from Nightingale College. I'm going to be performing the medication oral administration to my patient. Um, so I will start off with my 5 medications, which I got from the MIR. The first one, I will go ahead and make sure that I verify the provider's order and the MIR. And first of all, I'm going to verify the 6 right medications, which is right patient, right dosage, right drug. Right patient, right drug, right dose, route, right time, and documentation. Before I do that, I am going to verify 3 times to make sure that before I administer the medication. I am doing the 9 a.m. Morning medications. I will be using the diacetyl sodium 100 milligrams. The second one would be Warfare 5 milligram tablet, and then the third one is the furosemide 20 milligram tablet, and then the fourth one would be potassium chloride, which is 20 milligrams, and the acetaminophen, which is 500 milligrams / 15 milliliters. Okay, so I gathered all my supplies here. I have medicine and my gloves. So I'm going to grab all my things and I am going to walk into the patient's room. I'm going to set it by the bedside around here. I'm going to close the door for privacy. Hi, Ms. Smith. My name is Olga. Can you please verify your date of birth and your first name, last name? Okay, perfect. Thank you. And I will check her wristband to make sure that it all matches. I'm going to perform hand hygiene. And then next, I'm going to ask her if she has any allergies. Do you have any allergies for any medications? Okay, perfect. So your provider has ordered you 5 medications, and I will go over that with you. And I will go over the medications and the side effects and what they are doing. But before I will go back to my computer, make sure that I verify the MRR. Okay, just let me have one moment. I'll step out and check my computer, and then I'll come back and I will sanitize my hands again, and I will place my gloves on, my clean gloves. All right, Ms. Smith, so I will go over the 5 medications that you are going to be on. The first one is diastat sodium 100 milligrams. That is used for softening your stool, managing constipation. The side effect would be stomach pain, diarrhea. The adverse effect would be nausea and vomiting. The second medication that you'll be taking is Warfare, is 5 milligram tablet that treats blood clots. The side effects would be coughing or blood pressure or high blood pressure. The severe headaches. The adverse effects would be nausea, vomiting. The third medication that you're going to be taking is furosemide 20 milligram tablet. The side effects would be dry mouth, headaches. The adverse effect would be skin rash, nausea, potassium. The fourth medication that you're going to be on is potassium chloride, which is 20 milligrams. That treats low blood pressure. Treats low potassium. The side effect for that would be nausea and vomiting. The adverse effects would be stomach, bloating, severe vomiting. The fifth medication that you're going to be taking is a liquid solution, which is 500 milligrams / 15 milliliters. that is used to treat fevers, temperatures, and it helps treat pain levels. Some of the side effects would be a rash, itchiness, hives. Adverse effects would be like liver damage. So I'm going to make sure that I do a liver panel on you. Wash your hands. And some of the, I would like for you to make sure that you let me know if you have any side effects, any adverse effects, because we want to make sure that you are treated right away. Also, I'm going to go over some of the medication side effects. Also, for the diastase sodium, for that, adverse effects is vomiting and diarrhea, excessive bleeding. I want you to watch out for that. Warfare also, what I meant to say, welfare is excessive bleeding and rash. Fluorescemoid, we would have to check your blood pressure, your pulse, and your weight. For your potassium chloride, we would have to check your blood pressure and your pulse. And then acetaminophen, we would have to make sure that you are good with your liver. We could order you a liver panel to make sure that you're good. Also, if you're diabetic, we want to make sure that we check your blood pressure or blood sugar levels to make sure that it's not low. And I want to verify that you don't have any allergies. Okay, perfect. So Ms. Smith, I'm going to go ahead and we will administer the medications for you here. So do you have any questions for me? Okay, perfect. So we have 4 tablet medications that we are going to give you, and a liquid solution, acetaminophen. So we're going to start off with your tablets. I am going to make sure that I take them out individually. There's 1, there's 2, there's 3, there's 4. Okay, Ms. Smith, I am going to serve you. I want to make sure that you're sitting upright, you're comfortable, and you have no questions. Okay, perfect, you're good. So I'm going to start off. Do you take them all at once? Do you want some water? Okay, perfect. So I'm going to serve you the medications. Perfect. And I will give you some water to sip on. How are you feeling? Okay, you're feeling good. Okay, and the next step, we're going to give Miss Smith acetaminophen, and we're going to make sure that we grab it and the label and we shake it up pretty good. Okay, perfect. And we want to open it, and we want to make sure that we put the cap down, and we are going to pour, and we're going to put it on a flat surface. We're going to pour 15 milliliters. There we go, 15 milliliters. And then we will make sure that we wipe down the edges of that cap. And we're going to close that. Okay, Ms. Smith, I'm going to serve you the medication. Okay, perfect. How are you feeling, Ms. Smith? I want to make sure that you're doing good. Okay, you're doing good. I'm going to put my patient in a comfortable position. I will ask her if she needs anything. All right, perfect. All right, Ms. Smith, I'm going to check on you in a little bit. I will take off my gloves. I will perform hand hygiene, wash my hands, and I will go ahead and document my results. Thank you.